Hey guys, Dr. Greg with Judice Sports and Rehab. Today we're going to be talking about carpal tunnel syndrome. So we didn't get a whole lot of questions this week on the wrist, so I'm going to talk about one of the most common issues that we see in the wrist, which is carpal tunnel syndrome. Typically this is caused by a compression of the nerves in the wrist. So there are lots of nerves that run through the arm from the neck, and they go all the way down into the hand. And so the bones and ligaments form a tunnel in the front part of your wrist here, and there's one nerve that sits in there. It's called the median nerve, and if you have a lot of pressure on that nerve, you're going to get some of those numbness, tingly type of sensations into your hand, which can cause weakness, cause you some difficulties using like fine motor skills, like using scissors or writing or typing, anything that involves using your fingers very specifically. What usually causes that is, again, that increased pressure, which can happen from a variety of different reasons. So it can happen because of poor posture, it can happen because of traumatic impact, it can happen because of repeated use of poor mechanics. Typically what we see is that educating people and changing their mechanics, so getting the keyboard tray, instead of having to type out in front like this, getting the keyboard tray so that you can type with your wrist more in that neutral position, that flattened position, is more beneficial, and it keeps the stress off of the wrist, keeps the stress off of that median nerve. Other things, we can work on some stretching, we can work on some joint mobility to give some more space in that tunnel. And again, educating on posture. Sitting in that slumped forward position in general puts more stress on the nerves in the body, and so being able to educate you on keeping that good posture, that good position throughout your upper body, will take some of the stress off of the wrist. Some other treatments that we've seen in the past are that are fairly effective are splinting. Sometimes people will wear splints to keep from going to the extremes of position. Again, we try to maintain that neutral position of the wrist so that you're not going to the extremes this direction or the extremes this direction, which would put more stress on that nerve. And then changing the workstation, like we mentioned earlier, making sure that you're not in that extreme position while you're typing or while you're doing manual labor or whatever that might be, that increased gripping over and over. We want to be in as close to a neutral position of the wrist rather than those extremes. Carpal tunnel is also treated with surgery, and it's pretty effective and fairly safe as far as surgeries go. So basically what they do, they go in and they will make an incision, and they will basically pull the fascia that is holding that, that is putting pressure on the nerve. They'll pull it away and then snip it, basically to just give more space in that in the tunnel. So whether PT is effective beforehand depends on a variety of factors. If it's something that's bothering you, yes, it is something we can treat, but we'll know fairly quickly if it's going to be effective. We do have some referral sources for surgery if it comes to that, but you will need physical therapy post-surgery just to get the scar moving and to get your strength and range of motion back in the wrist. So there are a lot of different things that we can do, including stretching, like we said earlier. There's mobilizations to get more space within the joints, but surgery is a viable option if it comes to that. Hopefully we're able to avoid surgery. That's part of what we do here, is help people avoid surgery and medications and get back to their lives. So I think that pretty much concludes our video for this week. We got one more video in September, so next Friday I'll see you guys again, and I think we're going to do something a little bit different because the wrist does not have a whole lot of issues, so it doesn't have a whole lot of questions. So we'll come up with something fun for next week, but see you guys again next Friday.